Moving days coming up for one of the biggest hospitals in the Denver area. The dozens of remaining patients will have to be transported from the old hospital to the new one. Our Evan Krugel shows us the plan.
Getting ready for a big move can bring out all the emotions.
Isn't it exciting? Welcome to our journey.
But Casey Bogenschutz isn't just moving houses.
Yes, yes.
She's in charge of moving an entire hospital.
If you take the average square footage of a home and the square footage of our new building, it's like moving 250 homes.
Casey's team has been hard at work for weeks.
Suction tubing.
Unpacking what they can at the new Intermountain Health Lutheran Hospital in Wheat Ridge.
We've started the planning about 2 years ago for this move.
Next Saturday at 6 a.m., all of this stuff will be joined by people as ambulances begin moving patients from the old hospital to the new one, roughly 3 miles away.
We're planning for about 180 patients. It will take us between 8 and 10 hours to do that with 20 ambulances. So we will just be going back and forth, moving those patients.
38th Avenue will remain open with signs alerting the public to what's going on.
Because it could be alarming to folks to see so many ambulances coming back and forth and thinking, what is going on?
The plan is to stagger patients based on how sick they are, including some who aren't even born yet.
Every patient in our inpatient units, including the babies, will come over via ambulance on that day.
And while Casey has moved before,
yes, I have. A few times.
She's ready for this one to be done. 2 years of planning and packing.
This is a portion of that.
Leading up to the biggest move of her life.
There's all the emotions, but the top one is excitement for sure.
Again, this all happens next Saturday, August 3rd, and it's not just patients moving that day. They'll have a second route for trucks to move over things like all of those medical machines and beds. They really want to make this clear to people, though. The old hospital will stop accepting admissions at 6 a.m. That's when the new hospital officially opens. Kyle?
The choreography of it all is really quite impressive. But they're moving every patient that day, or they're moving some ahead of time?
Yeah, it's really quite a dance. They're going to move all the patients that day, but there are some contingencies here. For example, a woman in labor will not be placed into an ambulance and taken over to the new hospital while that's going on. So they are letting folks stay at the old hospital until doctors and staff there decide that it's safe to move them to the new one.
Really interesting. Evan Krugel, thank you for that.